Vaccinations are often associated with childhood, but did you know that vaccines are also essential for adults? Shamela Pullen tells us more in the health report.
The immune system typically weakens as we age, leaving us more vulnerable to infections and diseases. But vaccines can help strengthen one's immune response and protect persons from potentially life-threatening illnesses.
In the last 2 decades, we've seen multiple outbreaks of measles. Like in the United Kingdom, they had outbreaks of measles for a time. That was also happening to a lesser extent in the United States. We were seeing outbreaks of pertussis or whooping cough in adults in Canada.
The recommended vaccines for adults vary based on age, health conditions, occupation, lifestyle choices, and travel plans. Some commonly recommended adult vaccines include shingles and chickenpox.
So the average adult, middle age, you want to check and see if you need a diphtheria, pertussis, and tetanus booster. If you had gotten your hepatitis B vaccines, if not, you need them. If you had gotten varicella, which is for chickenpox, if not, you might need it. If you had gotten influenza vaccine, that should be yearly. And if you're in the 60 to 65 age group where you have more vulnerability for pneumonia, you would need your pneumococcal vaccine.
However, Dr. Pete Robinson says persons should consult with their healthcare provider to determine which vaccines are suitable for them.
Most pediatricians stock vaccines regularly, so they're a kind of easy way to get access. The average larger health center, like our type 4 and type 5 health centers, which we have one in every parish, should be able to give you the vaccines you need. And then some adult physicians are now starting to provide vaccines and medical centers. So you may be able to go to your GP or your family doctor and ask them. And if they don't do vaccines in their office, they should be able to direct you where you can go.
With our health report, I'm Shamela Pullen, wishing you good health.